If you wake up every morning feeling stiff, heavy, and strangely tired, like your body didn't fully recharge overnight, this is not something you should ignore. For years, I've worked with men and women over the age of 40 who believed their pain, weakness, and low energy were simply signs of getting older. They thought aching muscles, slow movement, and constant fatigue were now normal. But in many cases, aging wasn't the real problem. The real issue was something far more silent and far more dangerous: low vitamin D. Vitamin D deficiency doesn't usually arrive with loud warning signs. It sneaks in slowly. It hides behind symptoms people blame on stress, long work hours, or aging joints. I've seen patients who spent years treating back pain, knee pain, and muscle stiffness without realizing their body was simply starving for one essential nutrient. And the longer this deficiency goes unnoticed, the deeper the damage becomes. One of the first signs I often hear about is a deep, constant tiredness. Not the kind of tiredness that comes after a busy day, but the kind that never really goes away. People tell me they wake up tired, feel drained by midday, and crash in the evening, even if they haven't done much physical work. This type of fatigue is not laziness, and it is not just poor sleep. Vitamin D plays a critical role in how your body produces energy at the cellular level. When levels drop, your muscles and nervous system struggle to function efficiently, leaving you feeling exhausted all the time. The second sign is muscle pain that feels confusing and unexplained. It's not sharp pain from an injury. It's more like a deep soreness, tightness, or burning sensation that comes and goes. Many people describe it as feeling like they've exercised hard, even when they haven't. Vitamin D is essential for muscle contraction and relaxation. Without enough of it, muscles lose strength, coordination, and endurance. Over time, this leads to stiffness, cramps, and reduced mobility, especially in the legs, hips, and lower back. Another warning sign often ignored is joint discomfort that doesn't improve with rest. Knees feel weak, hips feel unstable, and shoulders lose their full range of motion. People assume it's arthritis or wear and tear, but vitamin D deficiency weakens the structure supporting your joints. It reduces calcium absorption, which directly affects bone density and joint stability. This is why people with low vitamin D often feel afraid of movement, because even simple actions feel uncomfortable or unsafe. What makes vitamin D deficiency so dangerous is that it doesn't just affect one system in your body. It slowly weakens muscles, bones, nerves, and even your immune system at the same time. And because the decline is gradual, people adapt to feeling unwell instead of questioning why their health has changed. By the time most people seek help, they're already dealing with limited mobility, chronic pain, and fear of falling. The fourth sign of low vitamin D is frequent illness and slow recovery. If you notice that colds last longer, infections come back again and again, or small injuries take weeks to heal, your immune system may be struggling. Vitamin D is one of the most powerful, immune-supporting nutrients in the body. It helps activate immune cells that fight viruses and bacteria. When levels are low, your defenses weaken, making you more vulnerable to illness, especially after the age of 40. Many of my patients are surprised when they learn that vitamin D also affects balance and coordination. This leads us to the fifth and most serious sign: increased risk of falls and fractures. People with low vitamin D often feel unsteady on their feet. They may stumble more often or feel unsure when walking on stairs or uneven ground. This is not just a balance issue, it's a muscle and nerve signaling problem. Vitamin D helps muscles respond quickly and properly. Without it, reaction time slows, increasing the risk of falls. For adults over 40, this becomes extremely dangerous. A simple fall can lead to fractures, long recovery periods, and permanent loss of independence. I've seen patients go from active, confident individuals to fearful movers simply because a deficiency weakened their bones and muscles without them realizing it. Another issue closely linked to low vitamin D is mood changes. Many people report feeling low, unmotivated, or mentally foggy. They lose interest in activities they once enjoyed. Vitamin D receptors are present in the brain, and low levels are associated with changes in mood and mental clarity. This is why vitamin D deficiency is often connected to feelings of sadness or mild depression, especially during long periods without sun exposure. Sleep problems are also common. People struggle to fall asleep or wake up feeling unrested. Vitamin D plays a role in regulating sleep cycles, and low levels can disrupt your natural rhythm. Poor sleep then worsens pain, stiffness, and fatigue, creating a cycle that's hard to break. What's important to understand is that these symptoms don't always appear together. Some people experience muscle pain first, others notice fatigue or frequent illness. This is why vitamin D deficiency is so often misdiagnosed or completely overlooked. After 10 years of working with patients, I can confidently say that many chronic pain issues improve dramatically once vitamin D levels are corrected. Mobility improves, muscles feel stronger, energy returns. But awareness is the first step. The most important thing I want you to understand is this: low vitamin D is not a minor issue. It is a foundational problem that affects how your entire body functions. Ignoring it doesn't just mean living with discomfort, it means increasing your risk of serious health complications as you age. One of the biggest mistakes people make is assuming they get enough vitamin D from sunlight alone. Modern lifestyles keep us indoors, covered, and away from direct sun exposure. Even people living in sunny regions are often deficient. Age also reduces the skin's ability to produce vitamin D efficiently, making adults over 40 more vulnerable. Another common mistake is self-diagnosing without testing. Symptoms can overlap with many other conditions, which is why a simple blood test is the only reliable way to confirm deficiency. Once identified, vitamin D levels can often be improved safely under proper guidance. I've watched people regain confidence in their movement after years of stiffness. I've seen chronic muscle pain ease, balance improve, and energy levels rise simply because the body finally received what it was missing. Vitamin D may seem simple, but its impact is powerful. If you recognize even one or two of these signs, constant fatigue, muscle pain, joint stiffness, frequent illness, or balance problems, don't ignore them. Your body is communicating with you. Listening early can prevent years of unnecessary pain and decline.